is going crazy right now about the lip flip. What treatment is actually better? What do you think?
This muscle is just too important.
Then, like, get the food back into the mouth.
I'm not really going to recommend a treatment that I don't think is going to lead to a happy patient.
So everyone is going crazy right now about the lip flip. But what actually is it, and is it right for you?
So what is the lip flip? So this is a treatment whereby the lip, or the top lip more specifically, is slightly lifted to reveal a little bit more of the pink. Now this treatment is usually done by treating the muscle above the mouth, which is called the orbicularis oris. And with this muscle, it's responsible for a lot of different movement patterns. For example, when you purse your lips, when you blow, when you collect food in the top of your mouth. So this muscle's actually got quite a lot of important functionality, and yet this is the muscle that's treated with a Botox or anti-wrinkle lip flip treatment. And essentially we weaken the muscle, and by weakening the muscle, it slightly upturns the lip.
So how is dermal filler lip treatment different to the lip flip? So lip flip, like Sanjay explained, is done using Botox or anti-wrinkle injections, and that's targeting the muscle. Whereas with dermal filler treatment, it's made up of hyaluronic acid, and that is used to add a little bit of volume and structure to create the shape. So what treatment is actually better for the result that you want to achieve in terms of lifting up the top lip? What do you think?
So usually when a patient comes to clinic, they've got a concern, right? So their concern is going to be, maybe I want to change the way that my top lip looks, or maybe I want to lift it. What's the best option?
Yeah.
So they might have an idea that they want to do a Botox lip flip, but actually it might not be the best option. I mean, from experience with this type of treatment, it's not one that we would typically recommend very often, because when we're using the sort of small doses of anti-wrinkle injections in this muscle, the longevity is going to be very poor. So typically with an anti-wrinkle injection, it should last about 3 to 4 months. However, with this treatment, because the doses are so small, we never get that type of longevity from this treatment in practice. The reason for that is, if we put too much of the anti-wrinkle injections into the area, this muscle is just too important. So if we over-relax the muscle that's going to be involved in speech, talking, lots of different movement patterns with the lip, drinking, then obviously that's going to have a lot of issues with people in their day-to-day life.
So therefore, if you're only going to put a small amount of toxin in, it's only really, in our experience, lasts between 2 to 8 weeks maximum. So it's something that you're going to have to repetitively get done. So that's, I think, quite a big negative with it.
Yeah, I mean, generally, if we're seeing a patient, we want the patient to be happy. And I'm not really going to recommend a treatment that I don't think is going to lead to a happy patient. And in this case, it's mainly due to longevity being very poor.
So what other negatives are there to this treatment with toxin or Botox or anti-wrinkle injections in the top lip? Well, like Sanjay said, your speech can be affected, especially when you're trying to say words beginning with S, or when you're trying to bring your lips together or pursing your lips. When you're drinking from a straw, that can be quite difficult as well. When you put lipstick on and you want to dab your lips together, that becomes pretty much impossible to do. Or say you're having a really messy meal, or you're having a donut or something and you've got things on your lip, it's hard to get the food back into the mouth. And some people say that other people will pick up on it and notice that your mouth is moving a little bit different to how it normally would move as well. So it can be something that other people pick up on. It can also shorten the gap between the base of your nose and the top of your lip, but where you want to do that or achieve that in certain lip treatments, with the Botox lip flip, what can happen is that it can be a bit unpredictable how much it will shorten that gap. And also, when you're trying to drink, sometimes it can become very difficult. Like, for example, if you're having your coffee, a lot of people have mentioned that it's sort of spilled everywhere. So you'll be drinking and like you might just drop it. So you've got to be a bit careful.
So what's going to be a better option? I mean, in my opinion, I would say for most patients whose main concern is going to be the shape of their top lip, who are looking for the type of result that a Botox lip flip will give, more often than not, that patient's going to be happier with the dermal filler treatment for many reasons. Firstly, whenever I'm treating a patient, I always like to talk about certainty and predictability. When we're doing a treatment like a Botox lip flip, as Dr. Zoya said, we start to lose a little bit of that certainty because of the way that the muscle responds to the treatment. Having said that, with a dermal filler, we can be incredibly precise. Obviously, these things are down to the technique, how it's done, the consultation, the quality filler. So there's a lot of different factors that go into this. But having said that, if you've got an idea of what you want your lip to look like, these things can be tweaked or augmented with high-quality dermal fillers in quite a predictable way.
One of the major factors as to why we think dermal fillers are a better option in this area is because actually the longevity can be much more. It can be up to a year, sometimes a little bit longer, depending on the quality of the product that you use. And also, your practitioner can be so much more precise with the sort of result that you want. So how much of a lift you want. Do you want the philtrum columns defined? Do you want the cupid's bow defined? Do you want the shape slightly lifted or lifted a bit more? And you can take it a bit more gradually. The unpredictability is taken out of the result because actually with the toxin, it can be unpredictable how much your muscle responds to it. So here is a picture of a before and after using dermal filler treatment to create a lovely lifted upper lip. And this is going to last you a good year to year and a half. And then on the other side, you can see a picture of a before and after of a lip flip using a toxin or Botox injection. And this is going to last you typically between 2 to 8 weeks.
So one common question is, how does this compare, or how is this different to a gummy smile treatment? So this is a completely different treatment. I mean, patients whose main concern is going to be a gummy smile, this is, they feel when they smile, they can see the gum under their top lip a lot more visibly than they'd like to. With this type of patient, we can also treat this using either Botox injections or dermal filler treatments or a combination of the two. But actually, the muscle we're injecting is completely different to the lip flip, because with a gummy smile treatment, we're treating a very small specific muscle that is solely responsible for elevating the top lip. So when we treat that muscle specifically, it can reliably drop the top lip by about 0.5 centimetre or so. So we have a lot of reliability and predictability, and also the longevity is going to be much better, more like 3 to 4 months, like we should expect with most Botox treatments. That compared to the lip flip, where we're treating a larger muscle that has a lot more functionality with a very small dose, makes it a lot more unpredictable.
Yeah, so for example, that muscle, the one that is used for the lip flip, is responsible for eating, talking, smiling, blowing, sucking through a straw. So it affects a lot more movement patterns, whereas the one for the gummy smile is only affecting the lifting of the mouth.
So in terms of combination treatments, this is when we look to combine, for example, a dermal filler with a Botox treatment. And in terms of the lip flip, I mean, whilst it might make sense to combine the two to get as much of a lift as possible, in practice it's very rare that we'll ever recommend anyone to actually get a Botox lip flip treatment for the reasons that we've outlined, mainly being poor longevity and less predictability. Obviously, we would explain it and discuss the pros and cons with the patient, but my ultimate aim is to have a patient who's going to be happy, and I think most people who are getting a treatment done would expect better longevity than 2 to 8 weeks for something. Having said that, for some patients who want to get as much a lift as possible, you could see why they might want to try it, even though it's not something that we would recommend. Really, the only type of patient that we would do this type of treatment in is going to be with someone who suffers from what's termed as smoker's lines, which are lots of lines and wrinkles above the lip. And this is more to do with the muscle kind of hypercontracting over time, forming lots of lines and wrinkles. And if the patient's bothered by those lines and wrinkles, the treatment for a Botox lip flip is the same, really, as the treatment for what's termed smoker's lines as a Botox treatment. It's more of kind of an anti-aging treatment rather than a lip shape manipulation treatment, although it'll achieve a little bit of both.
So this video wasn't specifically on lip filler treatments. We've got a whole separate video for that, so you can have a look at that on our YouTube channel.
So as with everything in this video, of course, every single patient is different in terms of their natural anatomy, their starting point, and what it is they're looking to achieve. The single most important thing is always going to be the consultation with your own practitioner, who's going to discuss every single thing with you in every little bit of detail. But what's your experience been with the lip flip type of treatment? It would be really cool to hear actually how you've got on, and if it's a treatment you've received elsewhere or if it's something that you've tried before, because as we've said, we're talking about our experience and everyone has different experiences.
So if there are any other subjects that you would like us to talk about, feel free to leave a comment below or get in touch.